2+ years of the COVID-19 pandemic have led to all-time highs for mental illness and the demand for psychological services, especially among children. This comes from a report from the American Psychological Association. David Filkins is here with us now with some answers to how we might be helping our kids through this mental health crisis. David is a manager at behavioral health at Priority Health. Good morning, David.
Good morning. Pleasure to be here today.
Yeah, and thank you for being here because this is an important topic. So why is speaking about mental health, whether you're a child or an adult, so important?
Well, it's crucial that we continue to raise awareness for those living with mental and behavioral health issues. We want to help reduce the stigma that so many experience when they're trying to seek out care. Every May is Mental Health Awareness Month, but we work to keep that going year-round to make sure we can provide that support, educate the public, and advocate for policies that'll help support people with mental health challenges and their families.
So how bad is the mental health crisis that's facing our children and teenagers today?
It's very intense. We're seeing that a lot of children are experiencing social anxiety, and the pandemic is affecting them by causing them to seek treatment much later than they normally would due to the challenges of COVID-19. A lot of kids are facing challenges related to trauma due to child abuse, loss of a family member, or just the everyday anxieties we're experiencing pertaining to the virus and unpredictable routines. Really, we need that support for them more now than ever, especially amongst a shortage nationwide of children's mental health resources.
So what are some signs parents should look out for in their children that might signify that their children are going through something?
Absolutely. You as the parent, I'm a parent myself, we know our children best. So as we notice those changes in behavior, it's important to look out for if there's frequent tantrums, increased irritability, especially in younger children. They may not come to us directly about this, but we'll notice those changes in behavior, talking about fears or worries. Sometimes it manifests as physical concerns, stomach aches, headaches without a medical cause. And in some of our older children, we might notice some low energy, decreased interest in things they used to enjoy, maybe sleeping too little or too much, or just having conversations about suicide, bringing that up actually with us. So just be sure to have that open and frank conversation with them when that does come up.
And what do you do after these conversations then? How do we help our children while we're waiting to find the right therapist or find the right mental health outlet?
Absolutely. Well, in the schools, we have access oftentimes to social workers or professionals there that can be a helpful resource. But when we're talking with our kids, we want to make sure we establish that open and honest communication. And you can always connect with Priority Health. Priority Health members have access to us through the phone number on the back of your ID card. We have our behavioral health team available 24 hours a day, 7 days a week. There's also local community mental health agencies that you can reach out to, and every county has one, so you can simply search for that, and those always have access 24/7 as well.
David Filkins with Priority Health, thank you so much for being here this morning.
Thank you. My pleasure.